Metformin is one of the most commonly prescribed medications for managing type 2 diabetes, helping millions of people around the world maintain better control over their blood sugar levels. While it's often regarded as a safe and effective treatment, like any medication, metformin can come with potential side effects. Understanding these side effects, along with what steps can be taken to address them, is crucial for anyone who is either already taking metformin or considering it as part of their diabetes management plan. Before we continue, I'd like to tell you about Dielon, a powerful blend of 13 natural ingredients, each carefully selected for their proven ability to support healthy blood sugar levels, enhance insulin sensitivity, and promote overall wellness. You can read more on diacelon.com. One of the most frequently reported issues with metformin is gastrointestinal discomfort. For some, this might mean experiencing nausea, bloating, or even diarrhea, especially when starting the medication or increasing the dosage. This happens because metformin can affect the way the gut handles glucose and interacts with gut bacteria. Studies have shown that around 10 to 30% of people on metformin report such digestive issues. While the intensity of these side effects can vary, many individuals find that their symptoms improve over time as their body adjusts to the medication. If they persist, switching to an extended release form of metformin or taking it with meals often helps minimize the discomfort. Another side effect that has garnered attention is the potential for vitamin B12 deficiency. Metformin can interfere with the body's ability to absorb B12, especially with long-term use. Research has demonstrated that individuals on metformin for several years are at a higher risk of developing low B12 levels, which can lead to symptoms like fatigue, numbness, tingling in the hands and feet, and even memory problems. Regular monitoring of vitamin B12 levels and supplementing when necessary can help prevent more serious complications. This is something to discuss with a healthcare provider, as simple blood tests can identify any deficiency and allow for early intervention. Some people have concerns about the potential impact of metformin on kidney function. It's important to note that metformin itself doesn't harm the kidneys. However, in individuals with pre-existing kidney disease or significantly reduced kidney function, metformin can increase the risk of a rare but serious condition called lactic acidosis. Lactic acidosis occurs when lactic acid builds up in the blood faster than it can be removed, leading to symptoms such as weakness, breathing difficulties, and confusion. Although lactic acidosis is extremely rare, occurring in only about 3 to 10 cases per 100,000 patients, it can be life-threatening. Regular kidney function tests and proper dose adjustments, as recommended by a healthcare provider, can help keep this risk to a minimum. Beyond these more commonly discussed side effects, there are rarer but equally important considerations. Some patients report changes in taste perception, experiencing a metallic taste in their mouth, particularly during the early days of treatment. While not dangerous, this can be unpleasant and may impact appetite. In most cases, this side effect resolves on its own as the body adapts to the medication. Staying well hydrated and pairing metformin with meals can help alleviate this taste alteration more quickly. Another less frequent but noticeable side effect is the potential impact on weight. Unlike many diabetes medications, metformin is not associated with weight gain. In fact, it may contribute to modest weight loss in some individuals. For people with type 2 diabetes who are trying to manage their weight, this can be seen as a positive side effect. However, if weight changes occur unexpectedly or are accompanied by other unusual symptoms, it's a good idea to consult a healthcare professional to ensure everything is on track. It's also worth mentioning that some individuals experience mild skin reactions or changes in their skin sensitivity to sunlight while on metformin. While these occurrences are rare, they can still be bothersome. In such cases, simple precautions such as using sunscreen and avoiding prolonged sun exposure can help manage these symptoms effectively. In most situations, the benefits of improved blood sugar control far outweigh these minor inconveniences. When discussing metformin, it's natural for patients to wonder if their own experience might be different from what's typically reported. Research indicates that individual responses to metformin can vary depending on factors like age, overall health, and even genetic predispositions. While this might sound intimidating, it really highlights the importance of working closely with healthcare providers who can tailor treatment plans to suit individual needs. Routine check ins, blood tests, and open communication are key to identifying any side effects early and adjusting the approach as needed. For those who are worried about the long term use of metformin, the evidence is largely reassuring. Many studies have found that metformin remains effective and safe even after decades of use. Its role in reducing the risk of diabetes related complications, such as heart disease and nerve damage, has been well documented. This long track record of safety and efficacy is part of the reason why metformin is often the first medication doctors prescribe for managing type 2 diabetes. While this video has explored some of the common and lesser known side effects of metformin, it's crucial to remember that the majority of people who take metformin experience significant benefits with only mild or temporary side effects. If someone does encounter issues, working with a healthcare provider can help identify solutions, whether that means adjusting the dosage, switching to a different formulation, or implementing supportive measures like dietary changes and supplementation.